Hey, church family, I wanted to take this opportunity to present you with another word of encouragement as we continue to pray for the end of this pandemic. Now, as we continue to track the spread of this virus, we shouldn't be surprised to learn that the data isn't always what it seems. For example, several Florida labs were recently exposed for skewing the percentage of positive cases. Not only are many labs failing to report negative cases, thereby creating the appearance of higher percentages, but the Florida Department of Health has also skewed the numbers by presenting several days' worth of positive tests as a single day spike. This is nothing more than a misrepresentation of the numbers. And listen, this isn't just happening in Florida. There's actually evidence that this data is being manipulated in many places throughout America. It was actually July the 2nd when a congressman from Missouri, he confirmed this by informing us about something that he learned from medical professionals who candidly confess, and I quote the congressman here. He says, "There's been a misreporting of deaths for people who may have been involved in, for instance, an auto accident, but had COVID in their system, and that deaths then being reported as COVID death because there apparently is perverse incentive to do that. The hospitals get paid more for a COVID death than they do for an auto accident." And that's the end of the quote. Well, in response to this claim, the Assistant Secretary for Health at the Department of Health and Human Services, he goes on to respond by confessing. He says, yes, there appear to be some misincentives to overcode. In other words, yes, the congressman was correct in saying that, and I quote, "the hospitals get paid more for a COVID death than they do for an auto accident." And it's for this reason that we don't really know how many people are dying from COVID-19 versus how many people simply died with COVID-19. You might not know this, but on average, more than 8,000 Americans die each and every day. And it's tragic, it's heartbreaking, but it's true. People die every day. People die of heart disease and people die of cancer. People die in traffic accidents and some simply pass away in their sleep. Now, if hospitals are financially incentivized to overcode every death by counting both those who died from COVID-19 and those who simply died with COVID-19, well, I can't help but to wonder, how should we understand the mortality rate of the coronavirus if those in authority are failing to make this distinction? Now, remember, on average, more than 8,000 Americans pass away each and every day. Now compare this to the 5,760 Americans who died just yesterday, either from COVID-19 or with COVID-19. How do we differentiate the group of the 8,000 who die every day from the 5,760 Americans who died yesterday? Are we to believe that 13,000 Americans died yesterday? And if not, then how many of those COVID-related deaths overlap with the rest of those who died with heart disease and cancer and the rest? Please understand, I'm not making light of this. My heart breaks for those who are mourning today because of the loss of a loved one. My prayers are with you and your family, and I weep with those who weep. And as I weep for the daily loss of life, I'm still left wondering about the overlap between the total number of those who die every day and those who died after succumbing to the coronavirus. Now, as we wrestle with this question, I would direct your attention to one in-depth study which has revealed this fact, that 60% of those who died from COVID-19 complications were actually patients who suffered from 3 or more pre-existing health conditions. And 21% were patients who had at least 2 of those pre-existing conditions. A meager 4% of COVID-19 deaths have occurred in patients who had no prior health conditions on record. Simply put, the majority of cases resulting in the fatality of the infected, well, they occurred in those who had 1 or more comorbidities. Now, we should most certainly do everything within reason to protect those who are vulnerable. And yet at the same time, it's important for us to remember that the daily numbers that the media is cramming down on us, they don't really take into consideration the daily morbidity rate that we rarely ever think about. And knowing that people are dying every day from all sorts of sickness and all sorts of disease, it's crucial for every Christian to just look for every opportunity to lead the lost into the grace of God by faith in Jesus Christ. With this as the goal, I invite you, join us this Sunday here at Calvary South Austin as we continue to get equipped to reach this lost and dying world. If you'd like to know more about our service times and the measures that we're taking to sanitize our facilities, well, you can find this information right here at calvarysouthaustin.com. I hope to see you soon, but until then, let's continue to fight the good fight of faith, all for the glory of God.